Marcus, a 35-year-old male, has been living with type 2 diabetes for 8 years. His medical history includes a non-ST elevation myocardial infarction, status post-angioplasty 3 years ago, hypertension, and hyperlipidemia. His current weight is 240 pounds, and he has a BMI of 35. He also has a remote history of pancreatitis. The patient was referred from primary care because his primary care physician had been titrating up his insulin glargine for over 6 months, starting at 10 units daily and now up to 30 units. But the A1C remains elevated at 9%, and the blood pressure stays above target. His diabetes regimen includes metformin, 1,000 mg BID, glipizide, 10 mg BID, glargine, 30 units. His A1C is at 9%, creatinine at 1.2. He is not checking blood sugars daily and forgot his meter at home. In the clinic, we download patients' glucometers. We can print different charts to show trends and patterns of how a patient's blood glucose is trending. Let's meet Marcus.
Good morning, Marcus. Good to see you today. I understand you forgot your blood sugar meter again today. But looking at the blood test results, specifically hemoglobin A1C level, I can see that the number is elevated, which makes me think that your blood sugars probably are high throughout the day, unfortunately. And it's always very helpful for us if you do bring your blood sugar meter, because we can look at the patterns of the blood sugars. We can see what part of the day the sugar is the highest and when you may need help the most with the medications. So that will help us to individualize your medication therapy.
Glucometers provide patterns of blood glucose throughout the day. When patients do not bring their glucometer, we are forced to rely on the patient's recall of blood glucose data, which is probably less accurate. We must therefore explain how this affects our ability to provide treatment options, emphasizing that it is an essential part of the visit.
I thought I had it with me, but I must have forgot it at home. Usually I'm pretty good. I guess sometimes I do forget to take some of my pills with dinner. At work, I usually have a small lunch, like a half sandwich and some chips. And I don't like to take my medication because it gives me low blood sugar. And I'm so busy throughout the whole day. It's just really hard trying to keep up with all of these medications all of the time.
Yeah, no, absolutely. I totally understand that. So when you mentioned that you don't always check your blood sugars, but when you don't check your blood sugars, when you don't take your blood sugar meter with you, do you usually take your medicine or you skip the medication also?
Well, usually I try to take it with dinner every night, but at work I just don't like to take it because it will lower my blood sugars. I'm just really busy a lot of the time, and keeping up with all of these medications all the time gets hard.
Yeah, absolutely. I'm sorry. I know it's not easy. And thank you for sharing this information with me. This is very helpful. But in order to understand for me better and to adjust your medication to your lifestyle, and use the goal as to make your blood sugars better controlled with minimizing the chance of getting blood sugars too low and also improving the risk of cardiovascular disease or reducing the risk of cardiovascular disease. I would like to learn more about your lifestyle, about your usual typical work day.
Yeah, I think that would be helpful. I'm just getting so frustrated because I've tried so much to get my blood sugar and my weight down, but nothing really seems to help. And it feels like my family and my doctors think I'm not trying hard enough, and that's just really not the case. It's like they want me to revolve my entire life and schedule around managing my diabetes, and that's just not practical, and I don't want to. I just feel like there should be better options.
Yeah, definitely. And I'm sorry you feel frustrated. It's definitely not easy. But let's start with ordering some tests first. So I want to repeat your hemoglobin A1C, which is a measure of 3 months blood sugar control. Also check your metabolic panel, which would include kidney function and electrolytes. We'll check fasting, lipid panel, and the urine test for protein or microalbumin.
Marcus is already on combination injection therapy according to the algorithm, including several oral medications and insulin, even though his A1C is lower than 10%. For Marcus, it is important to reevaluate the treatment regimen and consider the medications that will be addressing his diabetes control as well as his cardiovascular disease. 1 year later, Marcus and Dr. Bessina meet and discuss options to change his treatment regimen.
Good morning, Marcus. I was very glad to see your blood test result today that your hemoglobin A1C came down to 7.5%. So we're very close to our target of less than 7%, and I'm sure we'll be able to reach it.
Thank you so much, Dr. Bessina. I feel so much better than I did a year ago. I was even able to make some of the changes that you recommended. Based on what you said, for when my fasting blood sugar got below 100, I was able to lower my insulin by 2 units every 3 to 5 days. Also, based on what you said about my pre-meal blood sugar being below 100 with my low-carb meals, I was able to lower my glipizide as well. I'm now taking 20 units of glargine and a half tab of glipizide before meals. My next goal is to get off insulin altogether. Do you think that's possible? If I respond well to the empagliflozin and have no side effects, can we increase the dose?
I'm really glad you are tolerating the medication well and not experiencing any side effects. And as you suggested, we can definitely increase the dose of empagliflozin to 25 milligrams per day once a day. And with that, we will be able to decrease glargine insulin dose to 15 units per day. And if you experience any of the high or low blood sugars, please give me a call so we can make further adjustment. Please don't forget to drink plenty of water to make sure you're well hydrated so we can avoid any side effects of the medicine like urinary tract infection. And if you add your diet and exercise as a routine for diabetes management, we will soon be able to get you off insulin.
Thanks, and I'll definitely do my best. I just already have a really busy schedule. What's your recommendation for how much and how often I should fit exercise in?
Yeah, it's not easy, but if you view the exercise as your daily routine, as your usual appointments, and you come up with a time that is more easier for you to maintain this time every day as your routine, and if you can exercise at least 5 days a week, 30 minutes of cardio exercise, any moderate to vigorous exercise activity up to 150 units per week, make it as your habit and make it be consistent and just stick with it. That would make it easier.
I'll definitely try my best. Thank you so much, Dr. Bessina.
For now, Dr. Bessina and Marcus have found a more progressive combination of medications. They will continue to monitor his levels as he incorporates more physical activity towards the goal of eliminating insulin altogether. This concludes Case 2. When you are ready, please advance to the conclusion module in the course menu.